So this morning we presented the results of the phase B3 trial evaluating the role of afatinib in patients with EGFR positive non-small cell lung cancer. The trial was very interesting because it evaluated the real-world practice and the patient with a common and uncommon mutation. We evaluated the efficacy endpoint and the safety endpoint. For the efficacy endpoint, we evaluated the progression-free survival and the time to symptomatic progression. The results were very interesting because we evaluated overall 479 patients, treated all with afatinib in first, second, and also in third line. Patients with ECOG PS2 were allowed and achieved a survival of 6 months as for the patient with treated in third line. Interesting data coming from the overall that the progression-free survival was 30.3 months and the time to symptomatic progression was 14.9. The data about uncommon mutation were heterogeneous. Indeed, we have a sensitive and a resistant uncommon mutation, and in the future we'll evaluate the role of uncommon mutation and the afatinib in the pool and analysis of 2 big trials. This data today had some new information about a clinical practice confirming the role of the EGFR tyrosine kinase inhibitor, in this case of afatinib, and focus on the attention of the difference from clinical practice and the clinical trial, because in clinical practice we have a more heterogeneous patient population. In the clinic today, we just evaluate patients with a different characteristic, different mutation, different ECOG PS2, and this data only confirm the heterogeneity of clinical practice and hide the attention of the clinical, the randomized clinical trial that are very strict as an inclusion criteria. Toxicity profile was overlapped the results of the LUX-Lung3 and LUX-Lung6, the randomized clinical trial, and overall 54 patients reduced the dose of 1 step to 30 milligrams, and 18% of patients reduced 2 steps to 20 milligrams, and 88% of patients discontinuation the treatment for toxicity, in a majority for diarrhea. The important is that we are evaluating in the future the pooled analysis of 2 or 3 international clinical trials with the same characteristics.